Welcome back to Houston Life. If you've ever been told by a dentist there's nothing they can do to fix your smile, new advances in technology can help with even the most difficult cases.
Yeah, periodontist Dr. Michel Azer of the Texas Dental Implant Center stopped by Houston Life with his patient, Phyllis Sikes, to chat about her journey to getting a healthy new smile. Welcome to you both. It's nice to see you.
Hey, nice to see you.
Okay, we're going to get into the technology behind the situation, but Phyllis, let's talk about your story. You have 2 autoimmune diseases, and the first time you actually had an oral surgery was at just 2 years old?
2 years old was the first reconstructive oral surgery, yes.
So talk about this situation, because over the years you've had many procedures.
I have. I've had probably more oral surgeries than I can possibly count at this point, and it was really difficult. I mean, you know, even growing up as a kid, it was constant changes in my mouth, you know, constant uncertainty. And then as I became an adult and got permanent teeth, you know, Sjogren's causes a deterioration in your teeth no matter how good you take care of them. And so it was just a constant deterioration for me, and I definitely was looking for a more permanent solution when I came to Dr. Azer.
Your before and after photos here are just unbelievable. Sjogren's and lupus are the 2 autoimmune diseases you have. And bone loss, Dr. Azer, this is a big issue for a lot of people who struggle with their teeth. Essentially, traditional implants don't work because they don't have the bone to support it, correct?
That's right. The first thing about the Sjogren's syndrome is that it keeps a dry mouth, and then the teeth decay much faster. So maintaining the teeth is no longer an option. So that's why implants would be like changing the whole variable to a different strategy where the implants do not get decay. We're now just focusing on the bone. And then thankfully, Phyllis came in early on before the bone deteriorates too much, and she was able to get an easy surgery.
And you're able to prevent, with this type of procedure, additional bone loss?
Correct. The implants will be taking forces and transmitting them to the bone. It's like working out, basically. The more you work out, the more you lift weights, it sends the right signal for the bone to exist. And the same, like when you work out, it sends the right signal for your muscles to grow. It's the same concept in the jaw.
It's so interesting. And Phyllis, I know we were chatting during the break about how you had tried so many different things, and even with a denture that sort of temporarily worked, you were sort of starting at square one over and over again.
Oh, yes. Just about every reconstructive surgery I've had has been like that, where it's just kind of starting again with square one. Because even when you have a reconstructive surgery, the results of that was only lasting a few years before I would have more deterioration in my teeth, more deterioration in my bone, until it just kind of became a situation where I felt a little hopeless about it, you know, because I felt like there was no way to really fully repair my smile.
But it happened, and you
did.
have a beautiful smile now. How has this changed your life?
Oh, it has changed my life in many ways. So I was a foster and adopt parent for 8 years. So being able to kind of have a personable smile in situations like that, where you're meeting, you know, caseworkers, where you're meeting judges and lawyers and stuff, because that's all kind of part of the process. It makes a huge difference in how well you can present yourself.
I bet it does. And it's fast. This process is fast, which is why I think it's so incredible. The technology and just the advances, there's no more sending things off to a lab, in your case anyway. Talk to us about this design process and what we're seeing on the screen, Dr. Azer.
So what's displayed on the screen now is how the teeth are going to be designed after the implants are placed. For Phyllis, she was very specific about how she wants her teeth to show. In this design, that's what we call a preliminary design, where we propose a set of teeth and then do it, like screw it in the mouth over these implants. It's completely fixed, and then she got a chance to try it for a few weeks and tell us exactly what changes she would like to do.
See, that's so interesting. So you were actually, Phyllis, wearing these teeth, and then adjustments were made.
Yeah, about every 2 to 3 weeks, and it could be small things, you know, oh, you know, we want to move the midline a little bit, or hey, we want to see a little more flare in the arch in the back, or, you know, hey, you know, the shape of the teeth, how long they were. Every tiny little detail was addressed.
And that is sort of the point of your service. You want your customers to be happy. You're an implantologist, a periodontist, and so you know the health of the gums and the bone and the teeth. This is something that most places just don't have, this technology.
So I think I would pride ourselves in the process of making the finals. We make sure that you're happy with the prototype, which is a proposal of the final. And you try it for a few weeks before we commit to the finals. I've seen it happen in other places where the finals are delivered so early on, and then patients are not happy, and then they're required to live with them for the rest of their lives. So I think that's what sets us apart.
And not just from the way they look, but also the way they feel, your bite. Safe to say you're happy?
Oh, absolutely. To be honest, they feel completely like natural teeth.
Okay.
You still have bite pressure sensation and everything. It feels like natural teeth.
Well, and again, the before and after photos, they're so dramatic, they're so shocking. What would you say to someone else who's struggled with tooth problems their entire life?
I think that they should definitely come see Dr. Azer. He is phenomenal with working with financing and everything else. He's very detail-oriented. His office is phenomenal. It's definitely worth going out and seeing him.
He's very proud.
Yeah.
You should be very proud. I know you have a lot of great patients. Phyllis Sikes, very nice meeting you. Dr. Michel Azer, great to see you as well.
Thank you for having us.
Yeah, and congrats on the new smile.
Thank
it
you
really
so
is
much.
so beautiful.
Thank you so much.
And the Texas Dental Implant Center does have a special offer for Houston Life viewers. The first 20 callers will receive a complimentary consultation after a short pre-qualification call. That includes a one-on-one chat with Dr. Azer, 3D scan, and x-rays. All of that is a $1,000 value.
If you'd like to schedule your appointment, call 346-1ARCH. That's 346-663-2724. You can also visit them online at bestdentalimplantshouston.com.
And by the way, we do want to congratulate Dr. Azer. He received a 2025 Texas Top Doctors Award for excellence in periodontics and dental implants. So congratulations to Dr. Azer.
Big congrats.